points of agreement. Our Josh Leves talked with lawmakers on both sides of the aisle to find out.
So we've been hearing this cacophony of disagreement from the halls in Washington and echoing across the country. And what we want to do now for a couple of minutes is focus in on where many Democrats and Republicans agree across the aisle on health care. And to help us do that, we have two lawmakers joining us, actually from the same state. I'm really glad we're doing it this way. Representative Marsha Blackburn is joining us, as well as Representative Steve Cohen, both from Tennessee. Thanks to both of you for being here.
Thank you.
Very welcome. There's this interesting article I saw in USA Today that lists some places where there's a lot of agreement, Democrats and Republicans. Does each of you, and Representative Blackburn, to you first, agree that there should be government subsidies to help low-income Americans buy health insurance?
I think that there is a way that government subsidies can be done, and certainly many of us who have served in state legislatures have looked for ways to voucher people into a private system.
Okay, Representative Cohen, what about you? Do you see government subsidies to help low-income Americans buy health insurance?
Unquestionably. We do that now with Medicaid, a great program started in 1965. Lyndon Johnson signed into law about 44 years ago, Medicare and Medicaid, that are great programs referred to as socialism at the time that are as American as apple pie today.
One of the things they point out here is that lawmakers pretty much across the board want to see increased competition, including something like a marketplace in which people would be able to compare and contrast the different insurance plans and have more options. Is that a principle you both want to see?
There is a concept that Newt Gingrich has pushed forward with like a Travelocity type concept where you could go in and compare rates and compare what is offered in insurance plans. That greater transparency will help lead to greater competition, and that is something that is badly needed in the health insurance market.
Representative Cohen, are you pretty close on that one?
Well, I think so. The exchange would be an opportunity on a national level for people to compare the different insurance policies or offerings, and the public plan would keep them honest.
I think you both agree with this, preventing insurance companies from refusing to cover pre-existing conditions.
Yes, I think that what we have to look at here is that for those who have pre-existing conditions, as they go into the insurance market, there needs to be some kind of risk pooling that they can move into for a period of time with those pre-existing conditions.
I agree with Congressman Blackburn, but if she said that, for a while and go into a pool, pre-existing conditions are generally with you until you're deaf. And people, it's going to cost more to have people in insurance pools with pre-existing conditions, and that's going to cost some monies wherever it is. And if it's in the private sector, there needs to be some countervailing force to keep those private sector forces from getting up too high.
How far apart, honestly, do you think your parties really are in coming to a resolution?
Probably as far apart as the two sides of the Grand Canyon.
I think what we have is not so much a partisan divide as it is a philosophical divide.
Well, look, I'll tell you, we all obviously hope that if you are on opposite sides of the Grand Canyon, that these places in which you do agree on principle can start to serve as a bridge. Obviously, a lot of people counting on that ultimately happening. Thank you so much to both of you. Very good to have you with us today. We'll talk to you again.
Good to be with you. Thank you.
Always nice to be with Congressman Blackburn.
And if you would like to get even more information on this healthcare debate, how reform could affect you and your loved ones, check out our special Healthcare in America website on CNN.com. You'll get the latest from all the town hall debates. We have fact checks for you, iReports. You can even read the bills. They're lengthy, more than 1,000 pages. Go to CNN.com/healthcare. Now, how many chances of a lifetime do you get in your lifetime? That's pretty deep. Thousands of people in Atlanta, myself included, had one of those chances last night. That is Sir Paul and Hotlanta, the songs, the cool guitar. It was kind of like the mid-1960s again.
Are you one of those people who think you just can't learn a new language? It's not that you can't learn, it's that you've never tried Rosetta Stone.
I probably learned more in the first 2 weeks than I have in months of taking formal classes.
Rosetta Stone is so fast and effective, it's used by the State Department, NASA, the U.S. Army, and Fortune 500 companies, and it's the world's leading language learning software.
This is not memorization at all. This is natural speaking, natural learning, and you will learn things that you would memorize in other courses, and you'll do it much easier and much faster.
And to help you get started right away, we'll send you your first lesson absolutely free when you call.
This really is a great program.
I believe that you can learn
any language with this program.
It helps me do something I really want to do, which is to know another language.